Hi, I'm Faith Richardson, and I'm the Canadian author of Mosby's Canadian Nursing Drug Reference. This drug reference is truly a Canadian product with metric units, Health Canada approved drugs, and warning alerts. This short video provides an overview of the second edition. My goal in writing the Canadian edition of Mosby's reference was to make it highly useful to Canadian nursing students and practicing nurses. I think nurse educators will also find it helpful, not only as a drug reference in lab and clinical, but to pull it in as an adjunct text during pharm and patho classes. It can help bring into the classroom interactive learning activities with students, finding key information and discovering essential nursing activities for collaborative med management, including pre-assessment, monitoring, evaluation, and patient education of key drugs. So, why is this drug reference exceptionally useful for student nurses and nurse educators? I think there are two big reasons. First, each drug entry models a collaborative med management approach. That means nursing is front and center. Sure, drug entries provide prescriptive information. What drug reference doesn't? But in this Canadian reference, a wealth of information supports direct care nurses in fully engaging their skills in the administration, monitoring, teaching, and evaluation of patients in their care. Each drug entry supports that crucial 24-hour med management piece that truly is the work of nurses. How does it do this? Each drug entry provides Health Canada approved indications and any Health Canadian warnings, a brief description of action and uses, recommended dose ranges, significant and common adverse effects, known interactions, nursing considerations, including essential assessment needs, cues for safe monitoring, effective evaluation, and patient teaching bites. Whenever the research is available, specific patient populations such as older persons, children, infants, patients with kidney or liver concerns are addressed too. Oh yeah, and Canadian lab values and units are the norm. Regarding patient and family teaching points, these are real, not just those generic avoid driving while medicated types of advice. The teaching points are essential 1-minute priority teaching notes that can be delivered in short bites during the real work of med administration, monitoring, or other moments of patient connection. As we know in nursing, any moment is a teachable moment. Okay, so that's the first reason that Mosby's Canadian Nursing Drug Reference is exceptionally useful to student nurses and their instructors. Highly useful drug entry information that is Canadian and is nursing. The second reason is all about the appendices in the reference. They are not just filler. They are written for students and new nurses and provide a brief but thorough introduction to or a reminder overview of some key topics, such as what collaborative med management looks like in action, what the cytochrome P450 enzymes have to do with interactions, why we are concerned about the adverse effects of QT interval, or older persons in polypharmacy. And there are highly useful tables on insulin and insulin analogs, Canadian vaccines and immunoglobulins, and lab values important to check when monitoring medications. There's also a brief SBAR script for use when connecting with prescribers and advocating for med changes. Oh, and if the brain needs a quick reminder during your busy shift, there are MedMath formulas and abbreviations list too. Mosby's Canadian Nursing Drug Reference was written for you, Canadian nursing students and educators.